Good evening, it's Friday, July 24th, 2009, and this is Diana Wong with your evening report. Now, while the president's Nazi health bill deadline is assuredly pushed back, the fight is not over yet. Desperate efforts are being made to meet the president's now delayed deadline, and both the president himself and his loyal White House cronies, both from within and without the Oval Office, are working in tandem with their commander-in-chief to promote and ram through the Nazi healthcare program as quickly as you can say unconstitutional. Earlier today, Speaker of the House Nancy Pelosi, in a contentious meeting with Energy and Commerce Committee Chairman Henry Waxman, managed to force Representative Waxman into agreeing to bypass his own committee, in hope of bypassing criticism from the Blue Dog Democrats, so as to make the passage of the president's bill more expedient. Even though such an impulsive act could lead to revolt and opposition from both Democrats and Republicans within this committee before the bill comes anywhere close to a vote. Meanwhile, Speaker Pelosi's handler, White House Chief of Staff Rahm Emanuel, personally went to the Hill yesterday for a 3-hour negotiating session with Blue Dog Democrats, and again this morning spoke on NPR radio, uttering the president's line that we need healthcare reform that controls costs. The key thing is, we are now debating how to control costs. And if you want to control costs, one of the things the president talked about is to have a group of experts to ensure that the changes that are necessary to the system to make the system more efficient, more cost-effective, are done. Acting as a Nazi healthcare spokesman that would have made Hitler very proud, Rahm Emanuel used this load of cost-cutting jargon to make the argument that therefore this bill has to be passed for the president to sign it by the end of the year. And reporting on more of the president's pathetic but nonetheless impeachably fascist activities aimed to convince Americans that they need to support his T4-style health program, and that he can sport a toothbrush mustache better than the last guy. Obama was at 2 Chicago fundraisers yesterday where, on both occasions, he took the opportunity of his appearance to shamelessly tout his healthcare bill, turning the event of fundraising into a pep rally for Obama's health reform. And at one point in the event, the narcissist altogether uncorked, blurting out, "I'm from Chicago, I don't break. This isn't about me, it's about healthcare." But on the other side of this fight, a growing sane faction among legislatures is also weighing in against the White House reform. As more pressure is being put on certain congresspeople from the White House to ram through the Nazi health bill, others are demonstrating their opposition to the nature of the policy. For example, House Republican leader John Boehner released yesterday a carefully crafted message on the conflict between the proposed Obama reforms and the sanctity and dignity of human life. The message released by Boehner and colleague Thaddeus McCotter attacked the provision inside the health bill which targeted senior citizens, a provision which encourages healthcare providers to provide their Medicare patients with counseling on the use of end-of-life treatments, which may place senior citizens in situations where they feel pressured to sign end-of-life directives they would otherwise not sign. The message then read as follows: "This provision may start us down a treacherous path toward government-encouraged euthanasia if enacted into law. That at a minimum, this legislative language deserves a full and open public debate, the sort of debate that is impossible to have under the politically driven deadlines Democratic leaders have arbitrarily set for enactment of a healthcare bill." This provision of the legislation is a throwback to 1977, when the old Department of Health, Education, and Welfare proposed federal promoting of living wills for cost-saving purposes described as enormous. At that time, the late Cardinal Joseph Bernardine of Chicago decried this effort by saying, "The message is clear. Government can save money by encouraging old people to die a little sooner than they otherwise would. Instead of being regarded with reverence and cherished, human life is subject, in this view, to a utilitarian cost-benefit calculus, and can be sacrificed to serve fiscal policy and the sacred imperative of trimming a budget." With 3 states having legalized physician-assisted suicide, this provision could create a slippery slope for a more permissive environment for euthanasia, mercy killing, and physician-assisted suicide, because it does not clearly exclude counseling about the supposed benefits of killing oneself. Healthcare reform that fails to protect the sanctity and dignity of all human life is not a reform at all. So, this is the nature of the healthcare fight, and it's a fight we must win. But even as we maintain a clear focus on defeating the president's Nazi policy, the larger picture of the global breakdown crisis should remain the main issue. As LaRouche has correctly forecast, and as LPAC TV has consistently reported, Obama's rash and brainless push for fascism is being driven by the collapse of the international financial system, whether he knows it or not. He clearly doesn't understand how his psychological Nero-complex makes him a key tool of the British Empire, who in this crisis intend to reduce the world's population by billions. The very nature of this breakdown crisis is a rebuke against the long-standing monetarist policies that have dominated the world. The only solution lies in dumping any and all ideologies and assumptions that fall under the category of monetarist. We must adopt an entirely new outlook based on physical values, not monetary ones. That is really what the fight is all about. It's a fight against the fascists who would like to use the occasion of a breakdown crisis to cause a mass reduction of the world's population through all of the insane policies coming out of the Obama administration, for example, typified by the bailouts, the cap-and-trade policy, and the current health reform. You can view this fight on a macroscopic scale, looking at the entirety of the United States, but you can also see it clearly reflected in the state level as well. California Governor Arnold Schwarzenegger, like Obama, was chosen to prevent any real economic solution from being adopted to deal with the economic crisis, but instead was installed to manage the collapse by slowly removing those basic and vital services provided by the state that every citizen needs to survive, what we would call austerity. The current situation surrounding the California budget is only a symptom of the much larger breakdown crisis. The governor's strategy is to provide a momentary illusion that the crisis is over, just as he has proclaimed twice before this year. However, the continuing collapse of revenues, a collapse fueled by the shutdown of remaining industry in the state, dramatic decline of trade through the state's ports, escalating foreclosure and unemployment crises, and the savage assault on state workers, the healthcare system, and social services directed by Schwarzenegger means that the illusion of a balanced budget will be shattered, since the revenue projections used in crafting the balance are grossly over-optimistic. In order to achieve the illusion of a balanced budget, the present agreement, if passed, requires more than $15 billion in spending cuts, including murderous cuts in healthcare, approximately $4 billion in raids by the state against local governments, seizing revenues which are supposed to go to already cash-strapped cities and counties, withholding essential funds for education, which are supposed to be repaid after the crisis ends by 2012 or 2013, and accounting gimmicks, such as counting the last month of wages paid to state employees in the 2010 fiscal budget as part of the next fiscal year. It is also based on revenue estimates which are generated by economic modeling, which has been repeatedly widely inaccurate. But it is unlikely that those sectors under attack will buckle under pressure and accept this more brutal assault. State employees are threatening to sue over 3 unpaid furlough days per month, while state employee unions are discussing strikes as a tactic. Local governments are also threatening legal action if Arnie seizes their revenues. Students facing cuts in aid and loans and rising tuition are showing signs of fight, and groups of elderly and disabled citizens which are threatened with cutoff of aid have been mobilizing. For example, last week, a number of people in wheelchairs were arrested for barricading Schwarzenegger's office at the Capitol. LaRouche warned today that lawmakers responsible for the past year's trend of policy failure better change now. Otherwise, people are going to hunt you down and eat you, not because they hate you, but because they're hungry. LaRouche then continued his comments on the global economic situation today, saying the U.S. economy is hopelessly bankrupt. Every policy adopted since 2007 has been a failure. But it's not just the United States. The world in general is coming to a point of a breakdown crisis. When this year's fiscal period comes to an end, it will be the most stark evidence of the breakdown crisis. Unless something is done to deal with the entire system by no later than October 12th or 15th, then there is no chance for civilization. We've got to immediately reverse the bailout through a bankruptcy reorganization process, scrap the current monetary system, and go with an international credit system. So that is what we have to do. Lyndon LaRouche will lay out this crucial concept once again at his live international webcast on August 1st, 2009. So make sure you tune in so you can equip yourself with the right ideas to win the fight and make sure mankind actually has a future. Again, today is Friday, July 24th. This is Diana Wong signing off.